Introduction. Running and jogging improve cardiovascular health and overall wellness, but people with glaucoma often wonder if pounding the pavement could harm their eyes. Glaucoma is a group of diseases marked by damage to the optic nerve, often linked to higher than normal intraocular pressure, IOP. In a healthy range, blood pressure drives fluids through the eye, the ocular perfusion pressure, or OPP. For glaucoma patients, maintaining stable blood pressure and eye pressure is crucial. This article explains what happens to IOP and OPP during moderate to vigorous running, highlights exercise benefits for vascular and brain health, and warns about possible downsides like dehydration or impact shocks. You will also get practical tips on safe running intensity, staying hydrated, and special precautions if you have narrow-angle glaucoma, advanced vision loss, or balance problems. Finally, we'll give clear guidance on how far and how fast to run and what warning signs to watch for. How running affects eye pressure. Aerobic exercise like jogging, running, or brisk walking has immediate effects on eye pressure. Numerous studies show that IOP falls right after a workout. For example, a controlled trial found that after short-term moderate exercise, average IOP significantly decreased while OPP increased. Similarly, in healthy and glaucoma eyes alike, 30 minutes of steady treadmill running produced a significant drop in IOP. In other words, your eye pressure tends to go down once you start moving. However, certain moments during hard exercise can briefly raise IOP. Pushing your muscles hard or holding your breath, a Valsalva maneuver, may temporarily spike eye pressure. For example, lifting heavy weights or sprinting uphill might cause a brief rise in IOP. In most people, this rise is short-lived and offsets once the exercise stops and eye fluid outflow accelerates. Indeed, systematic reviews find that both aerobic and resistance exercises typically cause immediate IOP reductions when monitored right after stopping. In other words, even if a quick spike occurs during the most intense effort, the overall effect of exercise is to lower IOP shortly after you finish. After you stop running, your blood pressure usually remains elevated for minutes, especially if the pace was high, and then falls back. Immediately post-run, ocular perfusion pressure, OPP, which depends on blood pressure minus IOP, often goes up because blood pressure spikes with exercise. But as you cool down, blood pressure can dip below baseline, a phenomenon called post-exercise hypotension. When that happens, OPP may transiently drop. Since glaucoma is partly a vascular disease, low OPP, less blood flow to the optic nerve, can be an issue. In general, healthy regulation, autoregulation, keeps blood flowing in the eyes despite these changes. But if you have known issues with blood flow to the optic nerve, avoid leaving your blood pressure very low. As a rule, stay hydrated and cool down gradually so blood pressure does not fall too suddenly, helping maintain stable OPP. Long-term benefits of running for glaucoma. The gains from running go well beyond temporary pressure changes. Regular endurance exercise strengthens blood vessels, improving endothelial function, enhances circulation to the brain and eyes, and can protect nerves. In glaucoma, this matters because better blood flow and oxygen supply may slow disease. A large long-term study found that people who did more physical activity every extra 2 hours of moderate to vigorous exercise per week had about a 10% slower progression of glaucoma-related visual field loss. Animal studies also show that forced exercise triggers neuroprotective factors. It can shield the optic nerve from damage and reduce harmful inflammation. Exercise benefits for the eyes include widening of the drainage channels. One study saw that after 30 minutes of moderate running, not only did IOP drop significantly, but the Schlemm's canal, a key fluid drainage pathway, became wider in both healthy and glaucoma eyes. Better vascular health in general means better eye health. Regular running lowers the risk of stroke, dementia, and vascular diseases, which in turn protect the optic nerve and retina. In short, keeping your heart and blood vessels healthy with consistent aerobic exercise gives your optic nerve the best chance of resisting glaucomatous damage. Bottom line, moderately intense running helps lower IOP in the short term and supports overall vascular health of the eye long term. This can translate into slower vision loss over the years and better oxygen delivery to eye tissues. Potential risks of running with glaucoma. While the benefits of running are clear, there are some precautions to consider. dehydration, impact shocks, and certain eye conditions. Dehydration and electrolytes. Running, especially long or hot weather runs, causes fluid loss through sweat. Dehydration reduces blood volume, which can lower blood pressure and thereby reduce ocular perfusion pressure slightly. Chronic dehydration has been linked to various eye problems, so it's wise to start runs well hydrated. Drink water or sports drinks with electrolytes before and during longer runs. A practical tip is to sip fluid every 15 to 20 minutes on runs over 30 minutes. About 500 to 600 milliliters of water in the hour before running, plus 200 to 300 milliliters every 20 minutes during moderate exercise, is a good guideline, more if it's hot or if you sweat heavily. Balanced electrolytes, sodium, potassium, are also important to prevent cramping and maintain circulation. In ophthalmology, experts recommend considering hydration status in glaucoma management. In short, don't let yourself get more than mildly thirsty during a run. High-impact strain. Seesaw movements or jarring impacts, like downhill running or jumping, might, in theory, transmit stress to the head and eyes. There is no strong evidence that normal running damages the eye from shaking, but some people report transient floaters or pressure headaches after very hard workouts. To minimize risk, land softly, mid-foot strike, tighten your core to stabilize your neck, and avoid bending over abruptly during hikes or inclines, which can momentarily increase eye pressure. Also, avoid breath holding or straining. Use a natural breathing rhythm. If you feel eye pain or a pressure spike mid-run, slow down and breathe calmly. Medication interactions. If you use beta-blocker eye drops like timolol, be aware they can slightly blunt your maximum heart rate. This usually isn't dangerous, but you might notice you can't run quite as fast as friends. It also means your natural heart rate zone is lower, so be sure to gauge intensity by how hard you feel you're working, your talk test, or a simple rate of perceived exertion scale, instead of just an absolute pulse. In general, however, no glaucoma medication should prevent you from running safely. Just give your body a bit more time to warm up if you feel it. Guidelines for running intensity and duration. Experts suggest aiming for moderate intensity exercise most days. This means a pace where you breathe noticeably heavier but can still hold a conversation in short sentences. As a rule of thumb, moderate running is about 50 to 70% of your maximum heart rate. During moderate training, IOP typically declines as you exercise. Once or twice a week, you might include vigorous bursts, 70 to 85% max heart rate, if you feel healthy. Vigorous running tends to lower IOP even more. One study found high-intensity treadmill running cut IOP significantly, but it also causes more fluctuation, so use it cautiously. The safest intensity is whatever feels challenging, but not overtaxing. Intervals, short bursts of higher speed with walking rests, can improve fitness without continuous strain. For most adults, running 20-30 minutes per session, 3 to 5 times per week is a solid goal. Beginners should start lower, even 5 to 10-minute runs or run-walk segments, and add time gradually. For example, adding no more than 10% more mileage each week is a common guideline. Listen to your body. If you feel dizzy or the effort makes your vision blur, slow down or walk. Pacing yourself, using a slower jog rest break strategy if needed, helps prevent sudden blood pressure spikes or dips. As you build fitness, you can safely increase distance. There's no fixed safe mileage for glaucoma, but general running guidelines apply, e.g., avoid jumping from 10 to 20 miles per week all at once. The key is consistency. Regular moderate exercise, rather than occasional intense sprints or very long runs, will give maximum benefit without undue risk. Special precautions for certain glaucoma patients. Narrow angle or angle closure glaucoma. If you have narrow angles, prone to angle closure attacks, check with your ophthalmologist before intense exercise. If your doctor has performed laser iridotomy or recommends it, be sure that's done. Extreme spikes in adrenaline, very intense runs, can cause pupils to dilate, which in a narrow-angle eye could theoretically trigger an angle closure. While studies show physically active people often have milder narrow-angle glaucoma, it's wise to use caution. Avoid exercising in very dim light, which naturally dilates pupils, and stop any run that makes you feel nauseous or gives you a headache, phobia of color after exercise, as these could signal angle issues. Always get prompt laser or surgical treatment to eliminate angle closure risk as your doctor advises. Advanced field loss or low vision. If glaucoma has severely damaged your peripheral vision, be careful on uneven terrain. Loss of side vision is an independent predictor of falls. Run in well-known, flat areas. Parks or tracks are good, during daytime or in well-lit conditions. Consider having a partner or using a guided running app if you tend to veer off. If balance is poor, you might substitute some jogs with brisk walking or use a treadmill at home to avoid tripping. In general, keep your running environment safe and obstacle-free if your vision is compromised. Balance problems or elderly runners. Since even healthy older adults can have balance changes, factor this in. Use supportive running shoes and consider light trail or grass running to soften impact and reduce joint jolt stress. If balance is a concern, leaning more towards fast walking intervals or track laps can provide cardiovascular benefit with lower fall risk. Always make sure any route you run is well maintained, no potholes or tangled roots. If you faint or feel unstable mid-run, stop immediately. Recognizing red flags. While exercise is generally safe, watch for warning signs. If running suddenly causes severe eye pain or headache, double vision, or prolonged blurring of vision, stop immediately and rest. These may signal dangerously low ocular perfusion or spiking IOP. Persistent redness or halos around lights that don't resolve within a few minutes post-exercise, get evaluated. It could indicate pressure issues. Black spots or flashing lights, floaters during or after exercise may mean bleeding or detachment. This is an emergency. Chest pain or intense shortness of breath obviously also mandates stopping and seeking medical help. In general, if something feels off in your eyes after a run, not just usual slight dryness or sweat, check in with an eye doctor before running again. Otherwise, ordinary fatigue and dry eyes that improve with rest are not worrisome. Conclusion and recommendations. Running and jogging are encouraged for most glaucoma patients. The heart and blood vessel benefits usually outweigh small risks. Short-term aerobic exercise reliably lowers IOP and boosts ocular blood flow. Over months and years, maintaining fitness can help slow vision loss. To stay safe, run at a moderate pace. You're breathing harder but can speak, or use interval training if you mix in some faster bursts. Drink water before and during your run to avoid dehydration. Keep workouts steady and build distance gradually, listening to your body's signals. For an average adult new to running, starting with 10 to 15 minutes and adding a few minutes each week is reasonable. Veteran runners can often do 30 to 60 minutes daily if well conditioned. At the first sign of trouble, severe headache, vision changes, chest symptoms, stop and seek help. If you have narrow angles or very low vision, tailor your running. See a doctor about angle status. Run on safe paths. With these precautions, running jogging can be a safe, healthy part of life with glaucoma. Enjoy the cardiovascular boost and know that a stronger heart and vessels go a long way toward protecting your optic nerve. All links to sources are available in the text version of this article. You can find the full article at visualfieldtest.com. Thanks for listening. To check your visual field, click the link at the bottom of this article or visit visualfieldtest.com.